My name is Georgiana, and I will be presenting a unique case of severe hematochezia caused by a ruptured pseudoaneurysm of the superior rectal artery. Acute lower GI bleed results from a wide variety of causes. One rare cause of lower GI bleed is the rupture of visceral artery pseudoaneurysms and aneurysms. This is a unique case of non-traumatic acute lower GI bleed arising from a pseudoaneurysm of the superior rectal artery, which is a branch of the inferior mesenteric artery. The case involves a 45-year-old man with past medical history of paraplegia due to complicated surgical management of cervical spondylotic myelopathy, end-stage renal disease on hemodialysis, diabetes, and hypertension. He was brought to the ED from a rehabilitation facility due to painless hematochezia. On physical exam, he was normotensive but tachycardic with the heart rate between 110 and 120, and a copious amount of blood with clots for rectum, but no obvious source of bleed anally or perianally. His hemoglobin was low, 7.2, but he had a normal platelet count of 314,000. Imaging studies included a CT of the abdomen and pelvis with IV contrast, which showed a circumferential mural thickening of the rectum and sigmoid colon, and a large amount of feces throughout the colon, but no diverticulosis. Angiography showed a pseudoaneurysm from the right superior rectal artery with active extravasation into the rectum, as shown by image A on the left. Embolization with microcoils and gel foam occurred. Patient had repeat imaging after the embolization procedure, which demonstrated no further filling of the pseudoaneurysm or contrast extravasation. This is shown in image A on the right. His hemoglobin remained stable for the next days, and the patient did not require any blood transfusions. Before being discharged, a colonoscopy was done, which showed a 15-millimeter ulcer with a yellow-bluish bulge on the right interior wall of the rectum, about 1.1 to 2 centimeters above the dentate line, but no diverticular or arteriovenous malformations. His colonoscopy is shown in image B. So traumatic rupture of visceral artery pseudoaneurysms of the superior rectal artery has been reported, but this case is unique because it is a non-traumatic case. If we look at pseudoaneurysms versus aneurysms, the rate of rupture for a pseudoaneurysm is much higher at 76.3 compared to 3.1 for a true aneurysm. The patient denied constipation. However, the CT abdomen pelvis with contrast showed a large amount of feces. So stercoral injury resulting from neurogenic bowel likely played an important role in causing the rupture of the visceral artery pseudoaneurysm. Visceral artery pseudoaneurysms of rectal artery, they are rare, but they have a high mortality when they rupture. There's various therapies like endovascular therapy, which consists of coils, vascular plugs, injection of liquid embolic agents, or fluid diverting stents, as well as endoscopic interventions like thermal or vasoactive agent injections or hemoclips. However, when patients present with unstable, then interventional radiology is warranted as a first line of treatment. Thank you.